I've been doing this for over 20 years, and this past year was one of the most different. If they were sick at all, we had to see them in the vehicle. Our boundaries were stretched, and I think we kind of know what we're capable of now.
I would come home and tell my wife, okay, today's the day. I tested the whole family, they were all positive. Surely with me crawling in the back of that car and checking that kid's ears, today's the day I got it.
At the beginning, I said, we're going to get it.
I struggled, emotionally, but I think my main concern then and now are the children. Some of those kids, the only smile they saw was at school or from those teachers and administrators.
I couldn't answer the questions, you need this medicine, you need this treatment, look for these symptoms. I lost a lot of patients during COVID, and that was hard. Their spouses came down with it. I cared for them for 10 years. I probably had more anxiety and depression in the teen group than I ever have. I reached out to Dr. Dodd a few times because it's hard to treat a teenager for depression and anxiety. They already have so much, so many emotions and feelings at that age, and then being social beings is what they're all about, and we cut that from them.
And the great thing about children, as we all know, is that they're very forgiving and they're very resilient. But I think we've been seeing some of the younger ones, symptoms that to the trained clinician we know is manifesting anxiety and other things. Whereas parents, they're like, gee, this once precious child who was always so obedient and listened so well, why are they acting so different? And I know that Alcorn County Schools and Corinth District Schools, I think, did an excellent job of basically trying to create the safest environment possible to allow school to continue. I think they gave parents great options to either attend in person and know that their children would be safe, or if the parents didn't feel comfortable to allow it virtual. So I agree, there's probably going to be some long-term consequences, but thankfully with vaccines and all the hard work that the school districts put in making sure that things were safe, I'm hoping that we're seeing the light at the end of the tunnel there, that we're going to get kids back in. And like I pointed out, the great thing about kids is they are resilient.
They are.
And so they have shown an incredible spirit to, despite this, if you can name that emotion and say, hey, this is what you're feeling, this is why, and here are some things we can do to help. And oh, by the way, you don't have to talk to your mom and dad or your peers over social media or Skype or anything else anymore. How about you speak to this trained professional, and to see them be able to say, hey, I didn't know that was what was going on. Thanks for helping me figure that out. And then being comfortable saying, I didn't know I had anxiety, and now I'm better. That was a wonderful, it's a wonderful privilege to be able to be that person that helps somebody get that care.
And at that age, they don't know the words to use. They don't know how to tell you what they're feeling.
I think the expression, it's hard to see the forest for the trees. Mm-hmm. We're in it every day, and to us, when we hear the term hero, I think we all kind of get a little embarrassed, because to us, it's such a calling. It's a natural inclination for us to want to help. And so going to work and showing up was never a question.
Right.
We very much have the human side of, am I going to potentially expose somebody? But, to live through this time, you never want to live through something this severe. We're starting to see some good treatment options through the antibody infusions, that vaccines are protective against serious infections. I know that all those things were really, it was really cool for me to see and to reflect and think, wow, I'm living through a very unprecedented time, and we're actually starting to make a difference. So.
State Department of Health, the CDC, what are the rules today that we go by? And it was changing that rapidly.
I think a lot of anger, come out of it, and maybe that's what, the depression and anxiety part, because people are upset and getting, different information from different sources, and so.
And the unknown is always scary.
It's very scary.
And it was completely unknown.
Sometimes great things come out of bad situations, and I know that thankfully the insurance has saw fit to say, you know what, telehealth's probably a safer option. And I think that long term, a lot of people, and especially younger people, feel more comfortable with technology, but taking away that barrier to travel and taking away that barrier to take time off work for parents, allowing people to access quality mental health services through telehealth and being reimbursed for it is the key, which makes it sustainable. I think long term going forward, if there's a bright spot coming out of this pandemic, that's going to be the one. Accessing mental health is not as difficult as it used to be, and hopefully through this, people realize that there shouldn't be a stigma attached to it. It's no different than getting your broken arm fixed or treating an upper respiratory infection. Going and taking care of your mental health is critical.
But you hit it right there. There's such a stigma in this part of the country attached to mental health. And I'm hoping we have more providers now and more access and easier access. And I hope, if anything, that we have said it enough times, it doesn't mean anything bad or negative.
If we can get these children and even adults to realize that there's nothing wrong with it.
So thankfully there's some solutions that we didn't have 20, 30 years ago that we have now. I think another takeaway for parents is to realize that our kids are smarter than they think they are, and they're much more perceptive. And so one piece of advice that I've given all parents during this is just to be open and honest with your children, and when they know that you're able to verbalize that, I think it puts them at ease that they're not misreading the situation. Name our feelings, talk about them out loud, and I think that this next generation is going to be better equipped than we were to maybe handle some of those challenges.